Welcome to the lesson 2 of module 2. Today we are going to learn about asthma. When wheezing is more than just an allergy. Many people say, Doctor, it's just an allergy, little wheezing only. Asthma is like a road traffic. Asthma is like a road traffic jam inside your lungs. Air wants to go in and out smoothly, but suddenly the road becomes narrow. In this lesson, we will understand what asthma really is, why wheezing is a warning sound when asthma becomes dangerous. What is asthma? Asthma is a chronic airway disease. Think of your airway like a rubber pipe. In asthma, the pipe becomes swollen, muscles tighten, thick mucus blocks the path. What will happen? Air struggles to move. What are the most common asthma symptoms? The classic signs of asthma: wheezing, whistling sound, chest tightness, breathlessness, nighttime cough. Asthma loves midnight drama, daytime calm, nighttime emergency. Asthma triggers. What pulls the fire alarm? Asthma triggers are like fire alarms. Small thing, big reactions. Common triggers: dust, smoke, pollen, cold air, respiratory infections, strong emotions and stress. Does asthma become dangerous? Asthma is dangerous when wheezing becomes continuous. Breathlessness occurs at rest. Person cannot speak full sentences. Lips or fingers turn bluish. Relief inhaler is not helping. This is called acute asthma attack and needs urgent care. Common myths about asthma. Asthma is only in children. It's seen in adults too. Inhalers are addictive. If no wheeze, no problem. Truth: asthma can be silently but deadly. Asthma is manageable, but ignored asthma is dangerous. Listen to your breathing. It speaks before this body collapse. It speaks before the body collapse.